Hi, I'm Tran Miller, and I've been a general dentist for 20 years now. And just this last January, we opened up Sleep Better Bend. And what Sleep Better Bend is focusing on is helping patients with alternative CPAPs, making oral appliances. We're helping kids with tongue ties and tongue tie releases. And we're helping patients with TMJ problems. A lot of TMJ pain is hard to live with, and we've found a lot of good solutions for our patients. So, do you ever wonder or know if you're clenching? So really, our teeth should only come together 1% of the day, and that's when you're chewing and swallowing. So any more that your teeth are touching is considered clenching. And what are the consequences that can happen from this? You've heard of, I think a lot of people have heard of TMJ, which stands for temporal mandibular joint. But TMJ or TMD, temporal mandibular disorder, could encompass a lot of things. One being muscle pain and soreness. So if you rub right here and you feel like that's sore, yes, you probably clench. If you ever get headaches, tension headaches, in the front or in your temporalis here, you probably clench. With clenching comes with a lot of different consequences, and one being joint pain. Some people report that they can't open beyond 26, about 2 fingers width. We call this about 26 millimeters. Or that their jaw catches and they can't open up, or it's painful to open up anymore. So we're now seeing a lot of degenerative joint disease and degenerative disc disease. With modern technology, offices, our office has a 3D x-ray, and we're able to see if your joint is degenerating. So if your teeth are coming together more than 1% of the day, 99% of the day is what most people say, then that's going to lead to consequences in your jaw joint. A lot of us are getting knee and hip replacements nowadays because your knee and hip is degenerating. That also happens to your jaw joint. So if you're having a lot of pain in your jaw joint, any ringing in the ears, pain in the muscles, any clicking and popping is also not normal, very common. But this could be signs of degenerative joint disease or degenerative disc disease and or myalgia or pain of the muscles. So with modern technology, we're able to have 3D x-rays in the office. And for our patients with TMJ pain, which stands for temporal mandibular joint pain, or some people call it TMD, it's really important to have these images. What this shows us is this is a jaw joint. And with this patient, she came into me with what she had described, quote unquote, I feel like an ice pick is hitting my jaw. And what she was having degenerative joint disease. Her jaw joint itself was dissolving. And so she was having a lot of pain with this. And we could now capture these images in office. What we have done here is we've helped her regenerate her jaw. And you can see in this slide here where we've got this nice white outline is we are growing the bone back. We're regenerating it with something we call PRF, platelet-rich fibrin injections into the jaw joint. This patient had a closed lock. What does that mean? That she could only barely open up to fit a fork into her mouth. And so she hadn't been eating for over a year, and no one could help her diagnose her with this. So if you're looking for alternatives to CPAP, looking for better sleep for you and your child, and or having TMJ issues, come see us at sleepbetterbend.com.